Hello everyone, we are from small group discussion B9 and now we are going to present about our student project called Hematocolpos. This is our member and my name is Syakri Septiana Chandra with 3 last digit of student number 129. This is our outline divided into 3: introduction, literature review, and conclusion. First, the introduction. Background. Hematocolpos or hematometra is a rare condition which menstrual blood can be expelled as it should be. Patients with hematocolpos are often asymptomatic before the first menstruation or menarche. Hematocolpos can be misdiagnosed as ovarian mass and also constipation. Complication that may happen for hematocolpos is the urinary tract obstruction, causing urinary problem and also renal injury.
Greetings to our affiliator. My name is Dave Kasperman 2 with the last 3 digits of student number 107. I'm going to continue the presentation and talk about proper formation and objective of our student project. The proper formation of our student project is what is the definition, incidence rate, pathogenesis, clinical presentation, how to diagnose, the differential diagnosis, the treatment and the prognosis of hematocolpos. And the objective is to understand the definition, the incidence rate, the pathogenesis, the clinical presentation, how to diagnose, the differential diagnosis, the treatment option, and the prognosis of hematocolpos. That's all from me. Thank you.
Hi, my name is Kezia Krista Dundra Gavrila with last 3-digit number 160. I'm going to explain about the benefits of this presentation. It's to enhance knowledge and understanding about hematocolpos, and secondly, to become reference for further study of hematocolpos. Next slide is going to be explained by my friend. Thank you.
Hello, my name is Nadia Zalfakila with the last 3 digits ID student number 079, and I would like to deliver the first part, which is the definition of hematocolpos. So hematocolpos itself is a medical condition in which menstrual blood or secretory fluid accumulates in the vagina, and this condition occurs when the opening of the vulva is blocked and leading to the accumulation of menstrual blood in the vagina during puberty, due to hymen is not fully open, or other condition such as hymenal imperforation. This condition could be dangerous if left untreated because hematocolpos of the imperforated hymen can cause vaginal distension and cause stretching and obstruction of the urethra because of its proximity to the anterior vaginal wall. I think that's all from me. The next part will be continued by my friend. Thank you.
Everyone, my name is Ida Bagusari Glesana with my last number is 184. So today I'm going to talk about the incident rate and the epidemiology of hematocolpos. So in these cases, hematocolpos is very often caused by imperforated hymen, right? But the case that disease or imperforated hymen is very, very rare. The cases of that imperforated hymen are around 1 in 2,000 females per.
Hello, my name is Rosalia, and I'm going to continue the presentation about the pathogenesis of the hematocolpos. So the hematocolpos is usually caused by the obstruction of the vaginal canal or the cervix, which can cause the accumulation of menstrual blood, and it can be accumulated over the time, which cause the clinical manifestation, and also complications such as infection, inflammation, and necrosis of the vaginal tissue. This can lead to distension and dilatation of vaginal canal and cause pain for the patient. That's all from me. Next presentation will be continued by my friends. Thank you.
Hello, my name is Krisantal Draminrajo with the student number of 2002511230. Now I'm going to explain about the clinical presentations of hematocolpos. There are several clinical presentations of hematocolpos. The first one is abdominal or pelvic pain. The buildup of blood in the vagina can put pressure on the surrounding tissues and stretch them, resulting in pain. The second one is amenorrhea. Hematocolpos can delay or prevent menstruation because they impede the cervix or vaginal exit. The next one is vaginal swelling. Swelling of the vaginal walls can result from the buildup of blood in the vagina and may be felt or apparent during an examination. The next one is urinary retention. Hematocolpos can put pressure on the bladder in extreme cases, making it difficult to urinate or cause urine retention. The next one is back pain. Pain in the lower back may also be brought on by the pressure of the hematocolpos. And the last one is dyspareunia. An accumulation of blood in the vagina can be uncomfortable or painful during sexual activity.
My name is Sinta Miguel Musella with Student ID Project 2002511070, and today I'd like to be explaining about how to diagnose hematocolpos. First is through anamnesis with the patient's menstrual cycle and if past gynecological issues and current symptoms such as abdominal pain or urinary retentions, and then through physical examinations like the external examinations of the genital area. And the last one is imaging studies via ultrasound or MRI or magnetic resonance imaging, and will be explained a lot, continuing by my friend. Thank you.
Hello, my name is Indah Mutia and I'm going to continue to the differential diagnosis of hematocolpos. Hematocolpos in female adolescents differential diagnosis include ovarian mass and often the time is diagnosed as constipation or acute urinary retention. In the case of an adolescent female presenting with abdominal pain and genital pain, swelling, primary amenorrhea, and urinary retention, several other causes could be considered because a broad condition could be associated with abdominal pain due to the abundant number of organs in the abdominal cavity. Urinary retention in adolescent, which is also a sign of hematocolpos, could also be caused by neuritic process, voiding dysfunction, and others. Therefore, through clinical examination, including genital examination, laboratory, and further assessment such as MRI, is advised to localize and identify content and obstruction that happens. That's all from me. The next will be continued by my colleagues. Thank you.
Hello, my name is Azam Iras Afadila with digits number 094. I will explain about the treatment of hematocolpos. Hematocolpos is often associated with the presence of an imperforated semen. Treatment of this condition is through simple surgical procedure with several types of incision in the human membrane, but it is necessary to choose virginity sparing technique or endoscopic technique to maintain the intake of hymen. The virginity sparing technique includes making a small incision in the hymen rather than completely removing it. This enables menstrual blood to exit the body while keeping the hymen and maintaining the appearance of virginity. That's all from me. The presentation will be continued by my friend. Thank you.
Hello everyone, my name is Joshua Francisco Sofian with the student number 20025112229. Here I will explain about the transrectal ultrasound or TRUS and vaginoscopic septoplasty. This treatment involves the help of the USG, which is placed on the transrectal region. All right, this therapy involves draining the hematocolpos first, and then the remaining septum will be removed. Thank you.
Hello, my name is Putu Yudhistira Kawardana with Trilas student ID number 098. I will continue the presentation about the prognosis. Hematocolpos is considered treatable, although it still can left scaly because prognosis of hematocolpos depend on time the patient got treated. If the treatment is late, hematocolpos can cause endometriosis. Lack of early screening is causing hematocolpos patient present at their menarche with complaints like stomachache, urine retention, hydronephrosis, and many others. Even it can also interfere with fertility. So again, early diagnosis and treatment are mandatory to evade complication in hematocolpos. I think that's enough from me. The next presentation will be carried out by my friend. Thank you.
My name is Darren, and the conclusion to our presentation is that hematocolpos is a medical condition where there is accumulation of menstrual blood or secretory fluid in the vagina, which occurs when the opening of the vulva is blocked. The pathophysiology of hematocolpos is mainly due to the presence of an obstruction in the vaginal canal or cervix, which may be due to congenital or acquired conditions. Patients with hematocolpos usually present with symptoms of abdominal or pelvic pain, amenorrhea, vaginal swelling, urinary retention, back pain, and even dyspareunia. And to diagnose hematocolpos, it involves a thorough inquiry of medical history, physical examinations, and imaging studies. For the treatment of hematocolpos, it includes simple surgical procedures towards the imperforate hymen to clear a way for the accumulated blood or fluid to pass through. And lastly, the prognosis of this condition is very time dependent, where early treatment could help evade complications and preserve fertility. Here are the references that we use for our student project. Okay, that is all from our presentation. We apologize for any intentional or unintentional mistakes during the presentation. That is all from me. Thank you.